My name's Thomas Mroz. I'm an orthopedic spine surgeon, and I'm currently the chair of the Orthopaedic and Rheumatologic Institute at the Cleveland Clinic. You're listening to Interview with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Thomas Mroz, chair of orthopedic surgery at Cleveland Clinic. Doc, how are we doing today?
Doing well. Thank you.
Thank you for being with us. So getting started, what were your goals and aspirations during your residency, and how have those changed throughout your fellowships?
The goal when I was a resident was to get one of the top fellowships in the country. And then at that time, one of the top fellowships was UCLA, and it's still the person that mentored me since has moved to USC and took his talent with him. But when I went to UCLA, I realized that I wanted to learn a little bit more about spine surgery from a different perspective on the neurosurgery side and the minimally invasive side. So I did a second fellowship in Memphis, Tennessee with another person named Kevin Foley. And then that allowed me to expand my repertoire of what I could offer patients. It satisfied a lot of the curiosity that I had with the burgeoning techniques that were happening in spine at the time. And then I think ultimately, though, it allowed me to get the job that I at the location that I'm currently in. And then I have stayed there since.
So kind of taking us through that second fellowship year, right? What was your mentality heading into your first job search, and how that perspective changed in the beginning years of your career?
Yeah, I knew at the time that I wanted to join a large organization for different reasons. It would allow me to expand on my academic profile, but it would also allow me a lot of opportunities to satisfy some of my other ambitions with innovation and things like that. It's harder to do that if you're going into a smaller private practice, depending on what you're really interested in. I knew at the time that data repositories were going to be a big thing, not only from a patient-reported outcome and all that other stuff, but even if you go back to 2004, 2005, 2006, I mean, we were on the cusp of the technology computing curve that we currently find ourselves in now, and I knew there was going to be a lot of opportunity from an innovative perspective, from a commercializable perspective, being a part of a larger organization. And then I found the Cleveland Clinic. They found me. It was kind of a mutual synergy. And at the time, so much of it had to do with the feel. I mean, it's a hard thing to understand, but the people that were there, they seemed like all good people. They had vision. They had enthusiasm. They were high energy. It seemed like a right fit for me. And so there really wasn't a hard decision to make at the time. So I stayed at the Cleveland Clinic since then.
That's amazing. So kind of briefly take us through the journey on how you ended up becoming the chair of the program.
Yeah. So it was a kind of a long journey, to be honest with you. I started off as a staff. I was intently focused on developing my CB, doing a lot of research. I developed and started the clinical research lab at the Cleveland Clinic in spine surgery. And it was great fertile ground because we had a lot of eager people, fellow staff, my partners, the residents and fellows were all very, very eager to do that. And so I just wanted to create an infrastructure. Once I created it, it became a machine that enhanced the publication profile. I was traveling all over the place, and I just found myself, I've always been a curious person. How can things be done differently? Well, that doesn't make sense. Let's do it this way. Where's the future going to be held? How can I be a part of that? And as I went on in my career, I just found myself talking to different people throughout my own organization to coming up with solutions. And then they got bigger and bigger. And then I've realized, though, that it's harder to move the needle unless you are in charge to a certain degree. And so as I developed the spine infrastructure, I then became the fellowship director, which I did for a long time. And then I became the director of the Spine Center, which is a large integrated practice unit made up of surgeons, non-surgeons, and the like, over many different specialties. And so that was my very first true leadership role, I think, where I'm managing and responsible for a large group of people, but it was very appealing to me. It was kind of a pathway to start executing on some of my vision. And at the time, I was very intent on developing artificial intelligence platforms, expanding our footprint, figuring out a way how we can expand from our current traditional fee for service. I see you as a patient. I operate on you in my own network. Well, how can we think differently? How can we start expanding that reach beyond not only the Cleveland Clinic network, but thinking different digitally, down the road. And then, as I started to gain, incremental wins in that role, I think, I started looking at different things, and the department or the institute chair job became available. It was really appealing to me. I think I had a somewhat of a unique vision in terms of what I wanted to do for the institute. And then throughout the process, which was a peer reviewed, big committee that evaluates you and your faults and your merits, I think ultimately it was favorable for me. And I've been in the role for about 19 months or so, or something like that. Or not 19 months, about 16 months.
So thinking back, what would you say were some of the keys to your success that shaped your early career as you climbed the ranks in the academic world?
Oh yeah, well, one of the biggest assets for me was my mentor. I went to an academic fellowship, and that particular person is Jeff Wong. Jeff Wong was a very academically active and minded person, and he was instrumental, hands down, in launching my career. He integrated me into a variety of different venues within organized spine surgery and orthopedic surgery. And so I would say any advice that I would give to somebody coming up is if that is on your ambition, if that's what you want to do, then you need to be hooked up with somebody and mentored by somebody who's really going to take an active stake in your success after you leave, to get you on committees, get you on the podium, maybe, and make sure that you're learning, obviously, how to do the appropriate research that you want to do, how do you build a program, et cetera. So that first and foremost, I think, was the key integral part for me. But it just sort of happened for me. I spent a lot of time not only in the hospital doing the clinical side of learning how to do surgery and doing it proficiently and becoming, the best that I personally could be from a surgical perspective, but I spent a lot of extra time, unfortunately at night, in the evening writing the papers, but I would write anything I could, any work that was available to me, and you want a book chapter, I'll write it. You want a paper, I'll write it. And so I was very eager and I put the time in. And so I tell everybody, listen, if you really, really want that academic job, if you really want to build a CV, then you just put the work in, do it early and do it while you have time. And we have a lot of energy. You don't have a lot of obligation with kids and family and all this other stuff. And so it will happen. You just have to be tied in with the right people, put the work in, and the right things will happen. But, the other thing, I honestly, there have been a lot of talented surgeons that I've seen in my career that had, I think, aspirations of being in key leadership roles, whether it's ascending the administrative ladder to become a CEO, chief financial officer, chief operating officer, whatever it is, but all and they're talented surgeons, talented academicians. But I think what I would recommend to anybody is to develop early on the personality that's going to be seen as collaborative, somebody who's going to be collaborative, innovative, a people person, high emotional intelligence, being able to read people. That is a hard thing to explain. It's a hard thing to learn. I think a lot of it is innate. And certainly there are courses in leadership that talk about all these sorts of things. But, I think that the ingredients to be an effective leader, and my perception of what an effective leader really is certainly morphed over time. It's developed over time. But I think at baseline, anybody who wants to become a leader and become a chair, they should have this, the staple of characteristics. They're honest, they're humble, they listen, they can innovate, they have a vision, they can articulate that vision. And all those things are incredibly important. And honestly, when I first started out, I didn't know where I stood relative to others. I just knew I had a lot of ideas and a lot of energy, and I wanted to do things. And I was very good at listening and learning from people, from observation. I mean, that was something that was very characteristic of me since I was a kid, having older brothers and siblings that made all kinds of mistakes. And I sort of just skated through, made my own mistakes, but I didn't make the same mistakes as they did. Similarly, when you go into a professional environment, you will or will not learn how to read a room. I mean, I wasn't always the first to say something. I was quiet. I took everything in. And I always think that, when you're a group of people and you're going to say something, just make sure that you're adding something. You're not regurgitating. You're not speaking just for the sake of being heard.
Absolutely. Now, as a chair of the program, what advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
Yeah, I don't have a bias for academics or people who go into private practice. Ultimately, our goal is to take the best care of patients, period. And that should be on the tops of minds of everybody. So, but what I do tell them is the healthcare environment is going to change rapidly. Um, they need to look really, really intently at all the jobs that are available. And what I mean by that is look at every iteration of it, because practices are different. The job requirements are going to be different. Work requirements are going to be different. Pathway to partnership is going to be different. Compensation is highly variable. And as we move through healthcare is going to change dramatically over the next 5 to 10 years. And so what I tell everybody is, listen, make sure you're going to be happy where you're living. That's going to be key. Geography matters. If you're a person who loves being in the mountains, it doesn't make any sense to go to Idaho, or not Idaho, but like Iowa or Indiana. If you really want to live life and you're that type of person, pick a place that's going to satisfy that, because that's incredibly important. Because if you're not in a place where you're going to be happy, you'll probably end up leaving, which is going to press the restart button. And when you press the restart button, you're going to have to rebuild a practice. And it's just something that's dissatisfying for anybody that ever has to go through that. The second thing that I think is really, really important, and nobody wants to talk about compensation, but it is important, right? Because everybody comes out with, unless your parents paid for your medical school or you were in the military, you're going to come out with probably over $200,000 of debt. Compensation and reimbursement in general over the course of this country is contracting, and so it's really important. Not only the first and foremost is, and my message is always the same: do the right thing for the patients and make sure that you're in a good environment to do so. And you're with a collaborative group of people that are going to engender that sort of environment for yourself. And then make sure that from a business perspective that you're entering in something that is equitable, that is fair, that is going to position you for success. And then something that's going to be able to put you in a situation from a salary perspective that'll allow you to pay off your debt, build the life that you want, which is incredibly important. Because if you don't have synergy with all those sorts of things, it creates an environment for the person going through it that just sucks. It really does. It subtracts from your quality of life, from your job satisfaction, and none of that is worth any of it. So if you're gonna be one of the people that work really, really hard and you stay late, then in my capitalist viewpoint, as long as you're doing the right thing, you should be compensated for it. So you really have to look intently at contracts and the way the business is set up.
So as the leader, what are you looking for when residents are applying for fellowship spots, and also when medical students are applying for residency spots?
First and foremost, good people. I mean, people that have all the core characteristics that I mentioned. They're humble, they're ethical, their heart's in the right spot. They want to help people. I'm personally attracted oftentimes to people who are high energy, innovative, people who have done other things in life. When you talk to when you talk to a group of 20 people, and all of them come, and they all have intriguing stories, but oftentimes everybody's got a life story, right? I remember the most characteristic people that have talked to me during a fellowship or a residency interview. One built motorcycles, another person was a boat racer. And you would never tell this, you never learn that from a CV. So what I tell people is like, listen, be honest about what brought you here, what changed you and what developed you as a person, because medicine is a very diverse group of people. And if I'm going to be working with a resident for 5 or 7 years, or a fellow for a year, I guarantee it, they all look good on paper. When they get to the desk, they're all looking really good. They have high board scores. But I think what starts to really diversify or set people apart are things in their life, whether it was good or bad, that shaped them in some way, and they've learned from that. And if they can vocalize that, that is a very powerful message to anybody on my receiving end, particularly for me, because I view life as a very, very, very big, huge process. I've made tons of mistakes. I've learned from most of them, but it's made me into the person that I am today. And from a leadership perspective, I would not be anywhere where I am today if I hadn't fallen on my face. And so I like those stories. So when I interview candidates, I always tell them, I go, listen, be honest about yourself and bring something to the table. Like there's a couple of good movies, and one I always bring up is I think it's True Romance or something like that. There's this scene in an elevator where one actor was saying to the other actors, like, you just figure it out. You have to act. And in a way, I don't say that to because I don't want to be a synthetic interview or anything like that. but you have to be able to make sure that person on the receiving end that is interviewing you, that walks away and say, how could I not take that man or woman in my program? It's kind of like if you were looking at I don't know, if you're a professional athlete, yeah, you've got a great time in 100, but so do other people. You have to make sure that this agent wants to take you on and say, listen, this person's going to be great for whatever reason. And so it's that stick, it's that thing that's going to gel in an interview in 15 minutes that's going to make that person. So bring enthusiasm, bring energy, and bring a story. That's incredibly important, because everybody oftentimes looks kind of in the top echelon of performance, whether it's academic, sports scores, or something.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.